You might not believe this, but according to the CDC, over 1 in 3 people over 60 with arthritis report their pain is worst at night. Not during the day, not when walking, but right when they try to lie down and rest. Hi, I'm Dr. James Porter, and if you've ever felt that deep, aching stiffness in your knees, hips, or hands when you're simply trying to fall asleep, I want you to know you are not alone. Many of my patients say the same thing. Doc, I can deal with the pain during the day, but the nights, they break me. And I understand why. This isn't just about pain, it's about exhaustion. When your body can't get restful sleep, everything gets worse. Inflammation builds, your immune system weakens. You wake up feeling sore, sluggish, and discouraged before your day has even begun. What most people don't realize is that this nighttime pain isn't just age catching up with you. In many cases, it's your body quietly crying out for nutrients. It's missing vitamins that help control inflammation, repair cartilage, support nerve function, and regulate your immune system. And as we age, our ability to absorb these nutrients drops. Medications, poor appetite, and digestion changes all play a role. Without these key vitamins, your joints never get the support they need to recover while you sleep. Now, I'm not saying vitamins are a miracle cure. But if you're waking up every night with sore joints, tight muscles, and the kind of fatigue that seems to settle into your bones, this might be a missing piece of your healing puzzle. So today, I'll walk you through 5 essential vitamins, all backed by real science, that can support your joints and help ease arthritis pain, especially at night. And if this sounds like something you or someone you love needs to hear, I invite you to stay with me. This might be the beginning of a better night's sleep. If you're new here, welcome to the Golden Health Channel, where we talk about real solutions for people navigating life and health after 60. If this helps you, feel free to hit the subscribe button. No pressure, just a small step toward feeling more in control again. Now let's begin with the first vitamin, vitamin C, the collagen-building ally your joints are quietly begging for. When most people think of vitamin C, they think of immunity, maybe a glass of orange juice in the morning. But for those living with arthritis, vitamin C plays a much deeper role. It protects the very structure of your joints, from the inside out. Here's why. Vitamin C is essential for the production of collagen, the protein that forms the cushion between your bones, the cartilage, ligaments, and tendons that keep everything moving smoothly. Without enough collagen, that cushion begins to thin, wear down, and eventually crack. That's when bone rubs against bone, and pain becomes your daily companion. In osteoarthritis, this cartilage degradation is the hallmark. And in rheumatoid arthritis, inflammation accelerates the breakdown even further. Vitamin C doesn't just help build collagen, it also helps protect it from destruction. How? Through its powerful antioxidant action. Oxidative stress is like rust for your joints. Free radicals, unstable molecules generated by inflammation, pollution, even stress damage your cells over time. Vitamin C neutralizes these free radicals, reducing the wear and tear damage that fuels joint pain. In a 2004 study published in the journal Annals of the Rheumatic Diseases, researchers found that people with the lowest intake of vitamin C had a 3-fold higher risk of developing inflammatory arthritis compared to those with higher intake. That's a massive difference, and a clear sign that this humble vitamin is more than just a cold remedy. I once had a patient, Martha, 68 years old, who told me her knees ached so badly at night she avoided stairs completely. Her diet was limited, mostly toast and tea, hardly any fruits or vegetables. Her blood work revealed a vitamin C deficiency. We gradually introduced citrus, bell peppers, and a low-dose C supplement. Within 8 weeks, she wasn't bounding upstairs, but she could sleep through the night without that deep, grinding ache waking her up. Now, I'm not promising miracles, but if your diet lacks color, if fruits and vegetables are scarce, your joints may be starving for the very building blocks they need to stay whole. And remember, your body can't store vitamin C. It needs a steady supply, especially as you age. Citrus fruits, strawberries, kiwi, bell peppers, and leafy greens are all rich sources. For those who need a boost, a supplement of 500-1,000 milligrams per day may be helpful, but always check with your healthcare provider before adding anything new. As we move forward, keep this in mind. Healing your joints isn't about doing one big thing. It's about the small steps that add up, day by day and night by night. Up next, we'll explore another overlooked vitamin that supports your joints from a completely different angle, the one that calms your nerves as much as it reduces your inflammation, vitamin B6. If vitamin C builds the cushion for your joints, vitamin B6 helps calm the storm around them, especially when that storm is fueled by inflammation, nerve irritation, and immune overreaction. After introducing vitamin C to support collagen, the next layer of protection comes from vitamin B6, also known as pyridoxine. And here's where things get interesting, because B6 doesn't just affect your joints directly, it helps regulate the communication system between your joints and your brain. You see, B6 is essential for producing neurotransmitters, chemicals like serotonin and dopamine that influence not just mood and sleep, but also how your brain perceives pain. When B6 levels are low, your pain sensitivity can increase. That means even mild inflammation can feel like a deep, burning ache, especially at night when your body is trying to rest. But there's more. Vitamin B6 also plays a critical role in regulating homocysteine, an amino acid that, when elevated, has been linked to chronic inflammation, joint damage, and even accelerated cartilage breakdown. A 2006 study in arthritis research and therapy showed that patients with rheumatoid arthritis often had significantly lower levels of B6, and their inflammation markers were consistently higher. In other words, low B the 6th of May be quietly fueling the fire in your joints and raising your risk for complications beyond arthritis, including heart and nerve problems. I remember one gentleman named Frank, 72, who came in with severe morning stiffness and nighttime tingling in his hands. He assumed it was just age or arthritis, but his B6 levels were well below normal. We worked on adjusting his diet, introducing more B6-rich foods like bananas, fish, potatoes, and fortified cereals, and added a low-dose supplement. Within a month, the tingling had eased, and the stiffness no longer kept him in bed an extra hour each morning. For older adults, especially those taking medications like isoniazid or certain blood pressure drugs, B6 deficiency can be surprisingly common. And since your body doesn't store much of it, consistent intake is key. The good news? Getting enough B6 doesn't have to be complicated. The right breakfast, maybe some oatmeal with banana and walnuts, could give your nerves and joints exactly what they need to stay calm, nourished, and balanced. And when your nerves stop overreacting, your joints get a chance to rest, not just exist. Next, we'll look at a vitamin that rarely gets attention for arthritis, but may be one of the most important defenders of cartilage and bone integrity as we age, vitamin K. While vitamin B6 works to calm inflammation and nerve signals, vitamin K steps in as a structural protector, quietly guarding the cartilage that cushions your joints. It's a vitamin most people associate with blood clotting. But in reality, vitamin K plays a powerful, underrated role in joint health, especially in the way it controls how calcium is used in your body. Here's the key. Without enough vitamin K, calcium may end up in the wrong places, like your blood vessels or soft tissues, instead of where it's most needed, your bones and cartilage. That misplacement can lead to hardening of tissues, stiffness in joints, and accelerated cartilage breakdown. But when vitamin K is present in the right amounts, it activates a protein called matrix GLA protein, MGP, which directly prevents calcium from building up in cartilage and joint spaces. That means less stiffness, less calcification, and more freedom of movement. In a study published in the American Journal of Clinical Nutrition, researchers followed over 600 older adults and found that those with low vitamin K levels had significantly higher rates of osteoarthritis progression, especially in the knees. The difference was visible on imaging: thinner cartilage, more narrowing of joint spaces, and worse function over time. What makes vitamin K even more fascinating is how it works in tandem with vitamin D. Think of vitamin D as the transporter. It helps your body absorb calcium. Vitamin K? It tells calcium where to go. Without enough K, the calcium vitamin D brings in might not end up where you want it. I once had a patient named Alice, 70, who was taking high-dose vitamin D on her own, hoping to improve her bone health, but her knees were still stiff and sore. When we tested her nutrient levels, she was deficient in vitamin K. Once we added leafy greens to her diet, spinach, kale, and a bit of broccoli, along with a balanced K2 supplement, she noticed her knees didn't lock up in the mornings anymore. Vitamin K comes in two main forms, K1 found in leafy greens, and K2 found in fermented foods and some animal products. K2, in particular, has been studied for its ability to slow joint degeneration and improve bone strength in older adults. The takeaway? If you're taking vitamin D for your bones, but not paying attention to K, you might be missing half the equation. And if joint stiffness is worse in the morning or after long periods of rest, your cartilage may be crying out for the support that only vitamin K can provide. Next, we'll talk about its powerful partner, the one everyone knows but few understand fully, vitamin D, and why your nighttime inflammation may be a sign your levels are too low. As we just explored, vitamin K works hand in hand with vitamin D, and together, they form a protective alliance for your joints. But vitamin D isn't just a nutrient. It functions more like a hormone, quietly influencing nearly every system in your body, including the immune system that controls inflammation inside your joints. For people with arthritis, especially autoimmune types like rheumatoid arthritis, inflammation is the main enemy. Your immune system mistakenly attacks your joint tissue, triggering swelling, heat, stiffness, and pain, often at night, when your body naturally shifts toward repair. Vitamin D steps in here as a kind of immune system coach. It helps your body recognize what's dangerous and what's not. When your D levels are sufficient, your immune response stays balanced strong enough to fight infection, but not so aggressive that it starts damaging your own joints. And when vitamin D is low, that's when things can spiral. A 2011 study published in Autoimmunity Reviews showed that vitamin D deficiency is strongly associated with increased disease activity in patients with rheumatoid arthritis. Those with low levels not only experienced more pain, but also higher inflammation markers and more severe morning stiffness. Even in osteoarthritis, the wear and tear kind, vitamin D deficiency has been linked to greater joint degradation, particularly in the knees and hips. It affects muscle function too, which means less support for the joints and higher risk of falls, especially in older adults. The problem is, vitamin D deficiency is incredibly common, and many people don't even know they're low. After age 60, our skin becomes less efficient at producing vitamin D from sunlight. Combine that with indoor lifestyles, sunscreen use, and limited dietary sources, and it's no wonder so many of us are walking around depleted. I remember a retired firefighter named George, 74. He complained of deep joint aches that flared up as soon as he lay down at night. His blood work showed severely low vitamin D, under 15 nanograms divided by ml, which is considered deficient. After 3 months on a supervised supplement plan and moderate sun exposure, his nighttime flares eased, and he was finally able to sleep without needing an ice pack on his knees. For most older adults, a blood level between 30–50 nanograms divided by ml is ideal. If you haven't had your vitamin D checked in a while, ask your doctor. Supplements vary. Some need daily dosing, others are weekly, and it's important not to guess blindly. Food sources include fatty fish like salmon and sardines, egg yolks, and fortified dairy. But for many people, diet alone isn't enough, and that's okay. The goal is to restore balance, not chase perfection. So, if you find your joints tighten the moment you stop moving, if sleep feels like a fight against your own body, it may be time to shine some light, quite literally, on the role of vitamin D. But D isn't the only antioxidant protector your joints crave. Next, we'll look at a fat-soluble vitamin with calming anti-inflammatory power that may help ease the burning and stiffness that strikes as the world goes quiet, vitamin E. We've just explored how vitamin D supports your immune system and muscle strength. But when the lights go off and your body goes quiet, another player steps onto the field: vitamin E, a fat-soluble antioxidant that helps calm the internal fires of joint inflammation, especially during rest. You see, when you're active during the day, your movement actually helps flush out inflammatory byproducts. But at night, when you're lying still, those inflammatory molecules can pool in your joints, making stiffness and swelling feel worse. That's why many arthritis sufferers say their pain peaks during the quiet hours. This is where vitamin E earns its reputation. Vitamin E works by neutralizing free radicals' unstable molecules that damage your cells and accelerate inflammation. These free radicals are naturally produced in the body, but they can spiral out of control in people with chronic inflammation, poor diet, or oxidative stress from aging. In people with rheumatoid arthritis and osteoarthritis, studies show that levels of vitamin E are often significantly lower than in healthy individuals. A 2008 study in clinical rheumatology found that patients with higher vitamin E levels had fewer tender joints and lower markers of oxidative stress. That means less pain, less stiffness, and better mobility, particularly noticeable after periods of inactivity, like overnight. One of my patients, Linda, age 69, had a nightly ritual of waking up at 3 a.m. to rub menthol cream on her elbows. She said the joints felt like they were boiling after lying down for a few hours. When we reviewed her blood work and diet, it was clear she was lacking antioxidants, including vitamin E. We added a mix of almonds, sunflower seeds, and a small supplement to her routine. Within 6 weeks, she told me, "Doc, I'm not waking up from burning anymore. I'm finally sleeping through the night." Vitamin E doesn't work overnight, and it's not a magic pill. But when used consistently, especially alongside other anti-inflammatory nutrients, it may help quiet that deep, smoldering discomfort that many arthritis patients feel when the world slows down. Good food sources include nuts, almonds, hazelnuts, seeds, spinach, and vegetable oils like sunflower or wheat germ oil. For those needing supplementation, most studies use doses around 200-400 IU daily, but be sure to check with your doctor, especially if you're on blood thinners. And remember, vitamin E works best as part of a bigger picture, a routine that supports your joints not just during the day, but through the night as well. In fact, now that we've covered all 5 of these essential vitamins, it's time to bring it all together. In the next part, I'll show you exactly how to turn this knowledge into a simple, nighttime vitamin routine, one that's safe, practical, and tailored for people just like you. Now that you've seen what each of these 5 vitamins can do, how they support your joints, reduce inflammation, and help your body rest, the next step is making it part of your daily rhythm. And I'll tell you right now, it doesn't need to be complicated. When patients ask me where to begin, I always say this: start with food, not pills. That's where real healing begins. If your evening meal includes something like a handful of steamed spinach cooked with olive oil, or a few slices of roasted salmon with a side of carrots, or even a small bowl of fresh fruit, like kiwi or strawberries, you're already feeding your joints what they need. Add a banana in the evening or a bit of mashed sweet potato and you're getting B6, vitamin C, E, and even K without overthinking it. But I know how it goes. After 60, appetites change. Cooking every night can feel overwhelming, and sometimes, even with the best intentions, we fall short. That's when a gentle supplement routine can help not to replace food, but to quietly support what's missing. For vitamin D, many people over 60 need somewhere between 1,000 to 2,000 IU daily. The best time to take it is with your largest meal. Breakfast or lunch works fine. Vitamin C is usually taken in small doses, around 500 milligrams once or twice a day, ideally with food to avoid stomach upset. Vitamin B6 can be found in a simple B complex. You don't need much, often 10 to 50 milligrams a day is enough. For vitamin K, especially the K2 form, a small dose between 90 to 180 micrograms daily is typically used, particularly if you're also taking vitamin D. And vitamin E, often around 200 to 400 IU per day, should be taken with food to help with absorption. But please don't guess. Talk to your doctor before adding anything new. Especially if you're taking medications like blood thinners or corticosteroids, your vitamin needs may be different. Timing matters too. I often recommend patients take most of their anti-inflammatory vitamins with dinner. This allows the nutrients to absorb and begin working just as the body prepares for sleep when joint repair and immune regulation are most active. And most of all, don't try to change everything overnight. Start small. Maybe tonight it's adding a little spinach to your plate. Maybe tomorrow it's asking your doctor to check your vitamin D level. Maybe it's simply remembering that your joints are still worth caring for, no matter how long they've been hurting. Because healing isn't about chasing perfection. It's about showing up gently, consistently, night after night, and giving your body what it needs to do, what it was always designed to do: recover. In the final part, I want to leave you with something more than a checklist. I want to remind you of what's still possible and why it's not too late to feel stronger, lighter, and more at peace in your own body again. If you've made it this far, I want to thank you truly. You've just taken the most important step in healing. Not a pill, not a diet, but the decision to keep learning, to stay open, and to believe that change is still possible. Because I know what chronic joint pain can do. It's not just physical. It slowly chips away at your confidence, your sleep, your independence. And after a while, it becomes easy to think, this is just how it is now. But it doesn't have to be. Your joints are not beyond saving. Your body hasn't given up on you. It's still working quietly, faithfully every night, trying to repair, trying to restore. All it needs is a little help, a little support, a few missing pieces like the vitamins we've explored together today. I've seen this story change too many times to doubt it. A woman in her 70s who thought she'd never sleep through the night again, now walking her dog before sunrise. A retired teacher who once dreaded stairs, now gardening without that deep grinding pain. Not because of extreme treatments or expensive plans, but because they started small. One food, one supplement, one better night. So if you're hurting, if sleep feels more like a struggle than a refuge, I want you to know that your story isn't over. You haven't missed your chance. Tonight can be the start of something different. Start with one gentle change. A glass of water with your vitamins at dinner, a handful of leafy greens on your plate, a short talk with your doctor about what your body might be missing. And give yourself permission to expect more than just coping. You deserve comfort. You deserve deep, healing rest. You deserve mornings that don't begin with pain. Thank you again for staying with me through this journey. If you found this video helpful, I'd be honored if you shared it with someone who might need it. And if you'd like to join us for more science-backed, heart-centered health advice, feel free to subscribe to Golden Health. Take care of your joints, take care of yourself, and I'll see you in the next video.